One of the more common disease conditions that I typically treat is something called stress urinary incontinence. That's when someone will leak with laughing or sneezing or coughing. It can be very disruptive. It can really diminish somebody's quality of life. There are a lot of different treatment options for stress urinary incontinence, starting from conservative and moving up to more aggressive. Sometimes simple things like losing a couple pounds can help. Doing some physical therapy can help. Sometimes surgery is the answer. The most common procedure for treating stress urinary incontinence is something called a mid-urethral sling. This involves a small graft that sits under the urethra and helps suspend it in order to prevent leaking with laughing, sneezing, coughing. It has an average cure rate of about 85%, so most patients are able to go from having an issue to a cure. Even in those patients who don't get a cure, most of them report that they are significantly better than they were. So you really take a big jump in your quality of life doing that small intervention. The surgery itself takes about 20 minutes to do, involves making a small incision underneath the urethra. It's outpatient. Most patients are able to get back to work in a couple days. We can always try conservative options for treating somebody's stress incontinence. These involve things like a pessary or physical therapy, losing a couple pounds. Unfortunately, the cure rate on those is about 35 to 40%. Most patients will elect for a surgical option given that it's so minimally invasive and people can return to activity very quickly.